for the live workup process, you start off being sent information through the post, and then you have your initial consultation with the transplant coordinators and the relevant specialists. And I believe that took around an hour. And the questions are asked, what motivated you to come forward? And the question is asked, about your state of physical health and family background. So I was very pleased and quite happy to be able to give that information. But yeah, I was very happy. I was very happy with the process.
And that took, I think, 9 months.
I think it was about 9 months. Lots and lots of talking.
Yeah. But that was absolutely brilliant. I mean, they really laid it on the line and almost did everything to put you off or to put Esther off. There was no holds barred. And I appreciate their honesty, and they were really, really helpful.
I waited for my transplant for 8 months, and I was on dialysis at that time. I was quite anxious about the wait and hoping that everything would be okay while I was working up my dad for the transplant and hoping that he'd be a match. Just frustrated, anxious, and kind of worried about it because it's an operation for him as well, so you don't want anything to go wrong there. You're not just worried about yourself, I was more worried about him.
I was expecting to have sort of blood tests to somehow see if I was an appropriate donor, but I wasn't expecting to have such a longish process of different types of scans to look at sort of the quality of my kidneys, and I'd never really considered the concept of making sure that I as a donor would be okay without one of my kidneys. But of course, I suppose there's no point in taking a kidney off me if it's going to leave me with renal problems in the future.
The doctors said that I was over the average BMI and I had to lose weight in order to qualify for the transplant list. So that was like one of the major things holding back kept us back from doing the transplant is I had to lose about 10-15 kilograms to get down to the point where we could start the workup process. But once I got to that point, the workup process was pretty fast.
All the testing was done here across a few different weeks, but the appointments were quite short, so it fitted in really nicely with work. I had a few problems with anemia that took quite a few months to sort out, but they carried on doing the testing while I did my additional testing. Everything worked out. I think it took about 4 months to get to the point where we were ready to donate, and then we chose to hold it another few months so we could do it at Christmas when it fitted better with our schedule and it fitted better with our family schedule.
One of the tests came back and said we're blood group incompatible, which obviously causes a bit of a concern initially, but that then moved on to exploring new technologies which allowed us to be successful.
And then it just was a series of plasma exchanges. I think I had about 3 or 4 prior to the transplant, and then I think perhaps I had 1 or 2 after the transplant as well. And the process meant that gradually we became more and more compatible, and obviously that worked and enabled us to go ahead and have the transplant.
From my point of view, there was never really anything bad about it. It was, you've got an injection here or a scan here, and it became routine. It became as if Dad had been as routine as what I was throughout the years, and like previously said, it was an end goal towards achieving what eventually was achieved. It was, no nervousness or anything at my part. Bit of emotion in Faro Airport, but that were about it. They're the only time.
Yeah, you live on phone calls, hoping that every test you've had is positive, and obviously the initial one to say that you're a match is quite a key moment. And we've took the phone calls in supermarkets, in airports, and strange to take a call to say it's definitely on. Stood at a checkout, and the checkout operator quite amused while he stood with a tear in the eye. But that's the process. Great period really.
For me, the day of the transplant, it went quite quick because I went down very early in the morning. I think I went just before 8 o'clock in the morning. I didn't have that much time to really sit and think about it, and I was so busy signing forms and speaking to the anaesthetist that all of a sudden somebody turned up to take me down for surgery, and that was it. I was in the operating theatre and it went quite quick.
It was when Morag went down for to have the kidney removed that I started getting a bit nervous because, again, I didn't want her to be going through this whole traumatic thing, but that was the point where I started to get concerned. But then I got the word from the doctors that she'd come back all right, and then I was able to relax about it and go to sleep and wake up later when it was all done.
I got a chance to see him actually just before he went down. They wheeled him past the recovery room so we could see each other before he went through.
I remember the day that we did have the transplant, and I was waiting around, almost impatiently just to hear if you were well. And one of the transplant coordinators, Joe, kept coming down and keeping me informed, making sure I was okay. I did start getting a little bit panicky, but I think that's to be expected on a day of major surgery, and especially when the other person, already undergoing that is your brother. But it was nice to have the communication.
As the day proceeded, things were explained to me, so I knew what was going to be happening next. And I must say, when I came round from the anaesthetic, although I had a drip to give me pain relief, it wasn't as uncomfortable as I'd perhaps anticipated. And there were no major hiccups for me personally. I had the procedure done laparoscopically, so with a relatively small abdominal wound sort of in the groin.
My first thoughts were, have they taken it out? Has it come out okay? And then, how's Charles doing? But obviously there's a period of time where you're coming round a little more and waiting for the period of time, which is you just want it to go well, and you're waiting for that news that Charles was back from theatre and that he had a successful conclusion to our operation.
I think both first questions from either side of the operation were, is my dad alright or is Charles alright?
Has it worked?
Yeah, I don't think either of us asked another question first apart from, is the other respective person alright?
The next day they brought my dad down in a wheelchair so I could see him as well, and he was doing really well. A lot less wires than I had. And then he was discharged, I think about 3 or 4 days later. They let him go home.